Hello and welcome to another episode of Facebook Live. Today's session will be on bone marrow transplantation, and to discuss this we have with us Dr. K. Ashok Kumar, who is a hemato oncologist and bone marrow transplant specialist at American Oncology Institute, Hyderabad. Good evening, doctor.
Yeah, good.
So before we start with the questions, I would request to give our viewers a glimpse of your expertise.
I am Dr. Ashok Kumar, a practicing hemato oncologist and bone marrow transplant physician. For the past 6 years, I am working at American Oncology Institute, and till now we have done more than 350 transplants, which includes both allogenic as well as autologous stem cell transplants.
So my first question is, doctor, what is bone marrow transplantation?
Yeah, bone marrow transplantation is nothing but replacing the defective or diseased bone marrow with a healthy bone marrow. It can be from the patient's own body or it can be from a different donor. This is if the stem cells are collected from the patient's own body, then that is called autologous stem cell transplant. If it is from another donor, then it is called allogenic stem cell transplantation.
So my next question would, doctor, is bone marrow transplantation the same as stem cell transplantation?
Yeah, and the concept of bone marrow transplantation started in 1960s. At that time, they used to collect the stem cells from the bone marrow. So conventionally, it was called as bone marrow transplantation. But with the development of science and latest technologies, we used to collect the stem cells from just by keeping a small vein into the hand and collect the stem cells. Now it is called as stem cell transplantation, and both are usually synonymous. Both bone marrow transplantation and stem cell transplantation are synonymous.
So my third question is, doctor, why would someone require a bone marrow transplantation?
It all depends upon the various conditions and also the age group. If at all you take in pediatric patients, there the indications for transplant is usually in very common indication in our setting is aplastic anemia, where the bone marrow fails to produce adequate number of cells. That is called aplastic anemia. That is one of the common indications for doing allogenic stem cell transplant. And the other conditions being thalassemia, sickle cell anemia, and primary immune deficiency disorders, where their inherent immunity is very low. As a result, they are more susceptible for infections. There, the defective marrow will be replaced by the healthy stem cells. That is also one of the indications for transplant in children. When it comes to adults, the very common indication for allogenic transplant is leukemias. It could be either AML or it could be either ALL, that is acute myeloid leukemia or acute lymphoblastic leukemia. And one more in adults very common transplantation is autologous stem cell transplantation, where we do it in relapsed refractory lymphomas as well as in relapsed as well as myeloma as a upfront transplantation.
Okay. So the next question is, doctor, how can we find a bone marrow donor?
Usually in autologous stem cell transplantation, the donor will be the patient himself. The defective marrow will be cleared with the chemotherapy and then we will take up for the transplant. There the donor and the patient are the same. But in allogenic stem cell transplant, we have to identify another donor. It could be either siblings, parents or unrelated donor. Here what we do is we will take a buccal swab from the patient as well as from the donors, and we will do a test called HLA typing. There we will analyze the genes, how much they are suitable with the donor. A patient is suitable with the donor. Based upon that, we will call it as either full match donor or it is a half match donor. Based on that, we will proceed with the transplant. So the test which is required to identify the donor is HLA typing.
So my next question is, doctor, how long does it take for the donor to recover post BMT procedure?
Usually for the donor, it usually takes 4 to 5 days for the stem cell to collect from the donor, and immediately after collection of the stem cells, donor will become normal and he can resume his own activities one day after the procedure is done. And there is no much complications per se related to the donor. At the most common complication associated with the donation is body pains, which can be relieved with any mild analgesics like paracetamol, like that. Apart from that, there is no much complications related to the donor.
Okay. So the next question is, doctor, what are the risks associated with BMT?
With BMT, it's a long process. Usually, the patient will be in the hospital for at least 30 to 40 days. Usually, in the first 1 week, we will give chemotherapy. As a result of chemotherapy, what chemotherapy does to the patient is will destroy the defective marrow of the patient with the help of chemotherapy. And the side effects related to chemotherapy will be nausea, vomiting sensation, and they are susceptible to all kinds of infections because of chemotherapy related immune suppression. As a result of chemotherapy, by second week all the counts will come down to zero, like WBC will become zero, platelets will come down to less than 10,000, hemoglobin will fall, and during the second week of bone marrow transplantation, they are susceptible for all kinds of infections like bacterial, fungal, viral infections. So during that time, we have to take care of the patient just like any other normal newborn baby. So here we will give all blood products whenever required, like blood and platelet products, and treat the infections with antibiotics, antivirals, all those things. Or once the counts recover, then there will be other complication related to the bone marrow transplantation, that is called GVHD, and also the immunity will be low immediately post transplant. So here they are again susceptible to CMV reactivation, like any viral reactivation like CMV, BK virus, adenovirus, and we also watch for some other complication called graft versus host disease. This is called acute GVHD in short, where the donor cells will be acting on the patient's body cells. As a result, they may develop either jaundice, or they may develop loose stools, or they may develop a skin rash. So we will watch very closely for these signs and symptoms. And also after 100 days of transplant, we will be looking for other complications like chronic GVHD, like they may develop dry eyes, dry mouth, some complications related to the lung, kidney, and intestines, all those things. These are all the complications related to bone marrow transplantation.
So the next question is, doctor, will bone marrow donation make the donor weak?
Usually, as I already said, a donor may feel at the most is what the major complaint from the donor side is body pains, and that can be relieved with only the mild analgesics like paracetamol. Other than that, there will be no complications. Very rarely it may happen, but that is 1 in 1 million like that, but usually that happens very smoothly, and the donor can resume his activities as soon as possible, like within 1 or 2 days.
So my next question is, doctor, does a cancer patient require chemotherapy treatment after BMT?
Yeah, that usually in there are, as I already addressed, in pediatric patients, most of the conditions we do transplant are benign conditions. They are non-cancerous conditions like thalassemia, aplastic. There, after bone marrow transplantation, there is no role of chemotherapy. But in adults, when it comes to adults, especially in cancers like acute leukemias, when we do transplant, recent data is evolving on the role of maintenance chemotherapy, but still there is no standard recommendations. But some data is evolving on the role of chemotherapy post transplant. But as a guideline, there is no such rule that we have to give chemotherapy after transplant.
So my last question would be, sir, is BMT treatment successful? And how do the doctors determine its success?
All the bone marrow transplants, the success is not 100% in all the bone marrow transplants. Usually, it all depends upon the match, how the donor is well matched with the patient. For example, in allogenic full match sibling transplant, the success rate will be around 80 to 85%. In matched unrelated donor, it will be like 5 to 10% less than the sibling transplant. In haplos, it is even less, like around 50 to 60%. And how we determine the success rate is, first metric to identify whether our transplantation is successful or not is, we will do a test called chimerism. What does this chimerism do is, we will test the patient blood, how much of the patient's marrow cells have been replaced by the donor cells. If it is more than 95%, means that is the first metric to say that our transplantation is successful. And the one more thing is, clinically, what is the indication we are doing for transplant? If it is leukemia, If the after transplant, if there is no leukemia after 100 days of transplant and he is disease free, that is one more metric to say that is our transplant is successful. In another case, like in pediatrics, if you do transplant for thalassemia or aplastic, usually before transplantation they are dependent on blood and platelet transfusion. But after transplant, if this requirement is not at all there after transplant, that is also one metric for allogeneics to say that our transplantation has worked well.
Thank you, Doctor, for your valuable time and inputs. With this, we conclude our today's episode of Facebook Live. We'll be back next week with another episode. Till then, take care. Thank you.